My name is Nicole McNay.
I'm Jordan Placino,
I'll be arguing against physician-assisted suicide.
and I will be arguing for physician-assisted suicide.
I believe that physician-assisted suicide is wrong in every single aspect. It's wrong socially, morally, and medically. And I would think that humans at our core are supposed to be typically innocent. Life from its beginning to its end is not supposed to be a choice. Birth and death, I believe, are natural occurrences, and death especially should not be able to be a means to escape from life. Life should be worth fighting for, and just because there is an imposed threat of death does not mean that it's time to give up on your health. If you take Stephen Hawking, for example, he suffers from a rather rare disease in which the life expectancy is only 2 to 5 years after diagnosis. And he has lived with this disease for over 40 years and has actually been very successful. And it's inhumane for physicians who are supposed to be promoting, maintaining, and restoring their patients' health, such as patients as Stephen Hawking, to provide the means necessary for a patient to basically commit suicide.
I think there's nothing wrong with physician-assisted suicide. A physician's role is to improve a patient's health and alleviate suffering, but what if there's nothing more a doctor can do for a terminally ill patient that is suffering and pain? Wouldn't you want the choice to be able to end your own life on your terms? Wouldn't you rather die in the comfort of your home, surrounded by your friends and family, and not in a hospital bed? Why prolong the inevitable? If there's no cure for a terminally ill patient given 6 months or less to live, it should be allowed in all states for them to decide if they want to live or die.
But if you go according to the Hippocratic Oath, which about 98% of medical school graduates swear by, Hippocrates stated, "I will neither give a deadly drug to anybody who asks for it, nor will I make a suggestion to this effect." And this was written by one of our founding fathers of Western medicine, and the Hippocratic Oath outlines many moral and ethical standards, in addition to the one I just read, that physicians should all abide by, and it's going against the oath to do anything otherwise.
However, the Hippocratic Oath has been modified on a number of occasions over the past several years. Many references to women not being able to study medicine and doctors not breaking the skin have been removed. The modern version now states, "If it is given to me to save a life, all thanks, but it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and awareness of my own frailty. Above all, I must not play at God." If this is now stated in the oath and a doctor takes it, then they should have no problem in aiding their patients to take their own life or not.
But if you go according to Oregon, which is one of the states where physician-assisted suicide has actually been legal, physicians who provided the means for patients to commit suicide were present at the time of death for only 8 patients out of the 71 that died in the year of 2013. And that amounts to only 11.5% of the total patients that did die. And the worst part about gut-wrenching statistic is that only 2 of those patients that died were referred to for further psychological or psychiatric evaluation. And why would a physician allow someone who is terminally ill, which is a condition that often comes hand in hand with suicide and depression and other mental illnesses, make that decision for themselves without a psychological or psychiatric evaluation? It's a fleeting and ultimately avoidable feeling about a condition that can, in some cases, be maintained, and it should not be a means for patients to end their lives. Why would a terminally ill patient be allowed to end their life in a body where they no longer feel alive? I think that we should focus on the healing and the treatment of these patients and give them hope and empowerment to survive.
Physician-assisted suicide is now legal in a number of states, including Oregon and Washington, and in countries such as Switzerland and the Netherlands. The data from these places shows that the implementation of physician-assisted suicide does not lead to an uncontrolled expansion or abuse of the option, when it is accompanied by several safeguards, such as the illness must be terminal and the patient must be competent and cannot have a mental illness that can impair their judgment. The request must be voluntary, and they must understand what treatment and other care options are available. In Switzerland, it is shown that the number of assisted suicides has risen steadily over the past decade, but the number of suicides has declined. Only a small number of people who ask about the suicide assistance program actually complete the process, which indicates that the option is perceived to be a choice, that it can be abandoned, but nonetheless that they still should have the choice.
And you state that patients are not supposed to have mental illnesses, but as I stated before in the statistics from Oregon, the patients were not even sent to psychological evaluation. So that's why I believe that physician-assisted suicide should remain illegal.